The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your calls on your health. Perhaps you've had a problem. You've tried, you've applied, you've done all kinds of things that haven't worked. Well, here's your opportunity. Give us a call. Let's see if we can shed a different light on it from non-drug, non-surgical point of view. 888-630-9625. That's 888-630-9625. That's how you find us here. And by the way, when we're not here, we are here, but when we're not here, go to rosellecare.com. That's ROSELLECARE.com. And send us a note and have one of our doctors, our very fine practitioners, call you, and they'll discuss it with you. And if they can help you in any way, they'll make sure that that takes place as well. But today we're going to talk to you about something that we find kind of a interesting conundrum, if you will, on a day-to-day basis with patients walking into the office. And we're talking about laboratory testing, the errors and the omissions and the parameters that are never met quite the way they were intended to be, and sometimes exaggerated and used inappropriately. But in studio, to help me do that, to talk about it, to lift the veil off of it, if you will, your host this Wednesday evening at the Roselle Center for Healing in Fairfax, Dr. Leonard Poe, who's also our clinical director at the Core Concepts Chiropractic by Roselle in Broadlands. Anyway, Dr. Poe, welcome.
Hey.
Hey, how are you?
Good. How are you?
All right. Listen, we're going to be talking about an interesting subject. Let's start with simply, this question. How often, in your opinion, do doctors not order the appropriate test?
98.
98%? That is huge.
I see it a lot.
Yeah, unfortunately, that's the truth. And when we're talking about
if we're talking about in general, if you're looking for a particular thing, I think most healthcare professionals know what to order for that particular thing. But we're talking about general health, and I'm not feeling well, I'm not doing well, something's wrong, I'm not right. Let's order lab tests. Then I would say, I think 98% is, probably being overly generous.
How often do you see doctors ordering incomplete tests?
All the time. And what's worse is I see all the time that the findings aren't followed up on, which is another problem.
That is a problem. You get something come in. For example, the other day I had somebody bring in their laboratory work that was about 5-6 months old. And I said, let me see. Well, my doctor said that there's nothing wrong with my lab work. So I traced through it very, very quickly.
Everything's fine.
Right. Everything's fine.
Everything's fine.
Even in traditional laboratory ranges, we're going to talk about functional medicine ranges a little bit. Even in traditional laboratory ranges for vitamin D, 25-hydroxyvitamin D3, and we know that 85% of the population in this area is vitamin D deficient.
Correct.
Or either that or very insufficient. And the laboratory ranges go from about 30, 32 up to about 100. Mm-hmm. And here's this person sitting there with a vitamin D level of 29, and their doctor said, well, there's nothing wrong with that.
Yeah.
Nothing wrong with
Not even taking into consideration, about 5 years ago, the range was 50 to 100.
That's right. Because anything under 50 is considered insufficient, right. And 32, 33 or less is highly deficient. So you get that type of thing, and they're missing the boat.
They miss whole things like, what did you do about the urinary tract infection you had? I didn't know I had one. They never told you you had a urinary tract infection, or
yeah.
you had this. I see stuff missed all the time.
Oh, sure. When you do just a simple white blood count or a CBC, a complete blood count, and you have your white blood count, your red blood count, and you see the white cells that are slightly suppressed, and you see a shift in the lymphocyte neutrophil levels, and you know that they had some kind of, or they do have an ongoing suppressive problem due to an infectious state of some sort, but the physician never says anything about it. Half the time, my hallucination is that it's because the doctor doesn't know what to do with it when they find it.
Either that, or we don't have to get into this very deeply, or it's because, this is not covered, so I'm not ordering it.
Oh, you mean that insurance thing?
Yeah.
Yeah. Unfortunately, insurance companies will pay for certain things and they won't pay for other things. One of the other conundrums...
Because they don't care if you're well or sick.
Oh, you're using my old axiom. So here's what the deal is. You get a guy, for example, that has, he goes to the doc and he gets just an annual screening, and they do a PSA, prostate-specific antigen, which is really a measure, by the way, guys, just a measure of inflammatory reaction of the prostate. So if your prostate swells up a little bit, it tells you that you have some swelling, but it really doesn't tell you what it's all about. What has to be run with it minimally is a free PSA. And so just for your own knowledge, what you need to have is a very low total PSA, and you have to have a very high free PSA. If they go in reverse, now you got a problem. But you can't tell one without the other, really. Right. And there's so many guys that have been sent out for biopsies. But you can have a high PSA and a very, very, very elevated high free PSA. There's nothing wrong, really. Maybe marginally sometimes.
Yeah, benign hypertrophy.
Yeah. And you got to find out what that's all about.
But that's part of it. Is you see a lot of just incomplete testing done, whether it's prostate, thyroid. I see TSH all the time. TSH is a pituitary hormone. It doesn't tell you really functionally what the thyroid's doing. It's a lot of incomplete ordering of blood work. And it's either based off of, well, the insurance company will cover, I don't know, or I don't need any of those things to prescribe you this medication.
We're going to get into a little bit of the cholesterol and lipid patterns. I know this Wednesday evening you're going to get into these things in detail. And by the way, join us and bring your laboratory work with you, and you can ask questions based on that. And we can tell you what should have been run and what needs to be run and whether you really have an issue or not have an issue. Sometimes there's a witch hunt going on that's inappropriate, and sometimes there's things that need to be looked at that are not. And that's what we're going to cover this Wednesday evening. And you can tell whether or not you do have a problem, and based on that, what next steps need to be taken. 888-630-9625. That's 888-630-9625. That's how you reach us here. I'm going to go to the phones because this may be something that we can relate to. So, Joan, thank you for calling. How can I help you?
Well, I'm concerned about my adult son, who's 56. Last October, he ran in the New York Marathon. He finished, but at the finish, he got dizzy, and dizzy enough to have to grab onto a pole. Now, I don't live near him. I'm not sure what all happened next, but he did go to a doctor. He's always had low or normal blood pressure, but now he's got high blood pressure, and I'm not sure the medication, something LIN maybe, LIS.
Okay, so
lisinopril
probably.
What is it?
Lisinopril.
I don't know.
Okay, so let me ask you a couple questions because what you're dealing with could be one of several different things. Before the marathon, was your son on any kind of medication at all?
I don't think so. He does have a cholesterol problem, but doesn't take medicine for it. He eats oatmeal. He's very fit. I don't think he was on any medicine, but I don't know.
Okay, so let's take it through. Dr. Poe, you want to list this related symptom processes and how they step up, and then we can talk about the lab work that goes along with that as well. The dizziness, finishing.
I love when you do this.
Yes, you like that, right?
Yeah.
So no, finishing. What are the potential problems? Possibly, there's many.
Like a handful. I would want to check blood sugars for sure. If you just finished a marathon, I'd want to know what the blood sugar's like in general. Look at those patterns. Look at general anemia patterns. Look at other structural pieces. The thing that adrenal function. There's a whole handful of things considering you just finished a marathon. A big thing too would be though, if you have high cholesterol, I would look for other vascular inflammatory markers. See if any of those show up. People that generally, if you're entering a marathon, you're putting in a lot of miles. One of the trade-offs with doing a lot of aerobic cardiovascular activity is it does put strain on the blood vessels. So I'd want to really look at the vascular system for that and just make sure everything was intact well.
Yeah, Joan, there's so many different things. Even from sodium levels that could have been off, potassium levels that could have been off.
Yeah, that's tough. You just finished a marathon. I'd be dizzy after finishing 2 miles right now.
Well, I was just, thinking, oh my gosh, I'm glad he didn't drop dead at the end of it. I'm concerned maybe he should pursue seeing a cardiologist or a kidney specialist or something. Is there?
You know what, Joan? Here's what I'm going to do for you. We know some people that are really top shelf in New York. And if you do this, if you send us a note to the office, just go through the website, or just call in and ask the question, and they'll give it to either Dr. Poe or they'll give it to myself, and we'll tell you who to contact in New York. There's some really excellent people that we trust, and I would start there. I would encourage your son to go to these people, and they're natural physicians. They do functional medicine work, and they'd be able to weed through it and find out whether he's training too hard, whether he's had his blood sugar problem, whether or not his cardiovascular system's intact, whether it's a hypoadrenic pattern, whether the mineralization in the body is unbalanced. But those are the things that you start with, and they can ask all the questions. But do that, send us a note, and we'll be more than happy to make that referral. Dr. Poe, when you hear something like that, it can be a marathon runner, it could be somebody that just on a day-to-day, they get out and it's hot outside.
Yeah.
But you got to look at the different pieces.
Sure, you got to start digging.
That's right.
I mean, and it comes back to that basic triangle we always talk about. Is there a structural problem, biochemical problem? Is there an emotional stress pattern? It could be any of those things.
This Wednesday evening, your host in-house will be Dr. Leonard Poe. He's going to be talking about what we're talking about and touching upon right now, laboratory parameters, what really needs to be run. The limitations that unfortunately many physicians are struggling under, meaning the laboratory directives we won't pay for. And instead of asking you, listen, your laboratory won't, your insurance company won't pay for this, but, we think it's appropriate that you run this test. Would you like to do that? And there are cash laboratories that
there's tons. I'm going to talk about that. I mean, there's all sorts of ways to get this done and get it done very cost effectively. You don't put it in your mind that I can't afford to have any of these tests done. You absolutely can.
And even though that you're not feeling good and your doctor says, well, there's nothing wrong with you, sometimes it's a misinterpretation of the laboratory work, and you have to look at anything. You have to look at in parameters.
Yeah.
You have to look at functional. I'll give you an example. Functional medicine normals for the size of a red blood cell. Okay, that's part of your complete blood count. Is way different than your traditional laboratory markers. Laboratory markers, and I'm going to just give you the numbers, is 80 to 100. But a functional medicine normal for the size of the red blood cell, called a mean corpuscle volume, is 87 to 93. But if you're falling within the range of that other parameter that I mentioned, your doctor says there's nothing wrong with you.
That means you're not dying.
That means you're not dying.
Yeah. It's the difference between looking at it, and the analogy I use, you're looking at it as a pass-fail versus grading it. Is it a B? Is it a C? There's not a lot of difference academically between a 69 and a D, but you're still going to feel horrible. So it's not a pass-fail thing. Well, how well is it actually doing? How well is it actually functioning? And then you take all those different values and you kind of pull them all together and see systemically, how's this person really doing?
Wait till we start talking about thyroid values. Yeah. I mean, you're lucky if they run 2 out of about 8 or 9 different things that they should be running. But we're going to talk about that.
All based on dosage.
That's right. But this Wednesday evening, we're going to get into it intimately, specifically, and bring your stuff with you. We're coming up to a break. Dr. Leonard Poe, is my pleasure to be with me in studio. We'll be right back. Don't go away. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. We're in studio. 888-630-9625. That's 888-630-9625. Love to talk to you on anything that has to do with your health, as long as you want a comment that has nothing to do with drugs and surgery. Wouldn't that be interesting? You'd be able to pull things out without that? Well, we'll give you our opinion and see if we can make that happen. In studio, Dr. Leonard Poe. He is the director of Core Concepts Chiropractic by Roselle in the Broadlands. But this coming Wednesday evening, the 9th already of January, 7 p.m., he will be at the Roselle Center for Healing in Fairfax, and he's going to be doing a lecture on lab tests. Is your doctor ordering the right tests? What more do you need to know? How can you put this together? Dr. Poe, let's get back in. We said in the first part of the program that most tests are not complete, they're insufficient. Secondly, that even when they're reported in a range that is not specific enough. And in addition to that, there's much more that should be ordered, and a lot of doctors go on hunting expeditions and not very specific. And then I made a comment, my opinion, that a lot of times they're not ordered because of, two reasons. The insurance company doesn't pay for them, and so the doctor opts out. Or secondly, the fact that they don't know what to do with a lot of the things when they're coming down. It's keeping up with everything else. That's what we have to look at.
Yeah.
So this, when we look at these laboratory ranges, let's talk a little bit about, we talked about it on a program, I think 1 or 2 or 3 ago. We talked about thyroid function problems. And the patient doesn't feel well. They have all the indicators of thyroid. And, they're thinning hair on top of their head. They have the outer 1/3 of their eyebrows. They're missing. Their face is full. Their mental acuity is not as good. They're putting on weight. They can't get it off. And, they have rough skin, heels and elbows. And the doctor runs a TSH and a T4.
Yeah.
If they're lucky.
Yeah, if you get the T4 if you're lucky.
What should be done?
TSH. I like running total T4, total T3, free T4, free T3. I like to see the reverse T3. You want to run the TPO antibodies, the other thyroid antibodies. I like seeing T3 uptake. I mean, you really want to run if you want to see functionally what the thyroid is doing, you really need to run all those things to see.
And, the other piece is that if you ask your doctor if T4 is not being converted at the level, you have adequate T4. And if you're taking something like Synthroid, just putting a lot in there, but you're not getting enough T3.
That's the question is your cells don't use T4. That's the thing. They use T3. And so that's why they run the TSH and the T4, because they want to see, am I dosing the medication correctly? And that's really about it. It doesn't mean that T4 is converting correctly into T3 and that your cells are using it. It's just, it's there. You're running the test primarily for dosage, and that's it. But all those things really need to be run if you want to functionally know what the thyroid's doing.
It is. And, when you're dealing with the different hormones, it's important that which hormone is not being converted. I was just about to talk about the liver is responsible for converting T4, thyroxine, into T3.
That's where the vast majority of it is.
Right? Mm-hmm. And if it's not converting properly, you need to know why. But so you have to look at the liver.
Right.
And you have to look at...
Well, that's why you have to look at...
And you look in between the lines.
There's no system in the body that's by itself. They all commingle. They all go together. That's why you have to look at a person as a whole entity. And that's where holistic medicine kind of comes from. And you have to look at a person as a whole. You can't compartmentalize these different pieces and say they're okay. You can if you're looking for, are you dying? Do you have a cardiac condition? Then I can just look at the heart valves and that's it.
Let's quickly go to the phones. I want to talk to Robert. Robert, thank you for calling in. How can I help you? Robert. Okay, we'll have to get back to Robert. Robert, give us a call back, or we see you on the line, but it's not coming through. Steve, how can I help you? You have a recurring UTI.
Hi, good afternoon. Thank you for taking my call. I appreciate it. My question is that I'm 50 years old. I've actually had a reoccurring UTI from the age of about 20. I've been on every antibiotic I think they can prescribe, pretty much at this point resistant now to Cipro, or the bacteria is resistant to Cipro, and wanted to get just your thoughts, if you had any ideas based on your experience, if there were other options or ideas.
There's a lot of things that they're missing, and the fact that you've been on so many antibiotics tells me that it's probably not a bacterial infection. If you can get a fungal or a yeast type of infection that will go into the prostate or go up into the urinary tract in men, and here's the problem, is that when, if you're with your partner and you're having intercourse, you're going back and forth, and you're infecting each other. And until both of you are treated, if it is any kind of infection, it's never going away. So both people have to be evaluated, and laboratory work has to be looked at. So my primary my guess is that without really looking at all of your work, and you have to look at the subfractions of the white blood cells to tell, but it's not a bacterial infection. You've been treated with too many things and some heavy-duty drugs that should have knocked it out.
Or structural, and you're not fully emptying.
That's right. Or the urinary tract is not continuing to empty completely, and the bladder's full regardless. We're coming up to a break. Don't go away. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. Just a heads up, everybody. We're having a little people difficulty in the studio today. What I'm saying about that is that there's many of you that have been trying to get on the line with us, and what I would encourage you to do is, if we weren't able to pick you up, is call back, because my engineer is here by himself. Our call screener is out, unfortunately, today, and so he's juggling, and he's doing a great job in juggling, but nevertheless, don't hang up. Just keep calling until we get to the phone, and we will make sure that we talk to you. Our topic in studio are laboratory tests. Is your doctor ordering the right test for you? And also, is he interpreting them properly? Is there anything else you need to be doing? This Wednesday evening, the 9th, coming up at 7 o'clock at the Roselle Center for Healing in Fairfax, Dr. Leonard Poe, who is the director of Core Concepts Chiropractic by Roselle in the Broadlands. He will be your host, your presenter. And this is a topic that really needs to be looked at, because so many of you are having tests that shouldn't be ordered. Some of you are getting tests that really need to be expanded upon and interpreted properly. And here's an opportunity to talk to somebody who really knows their stuff. But having said that, I want to just touch on our last caller. And Steve, you talked about a urinary tract infection that you've had now for 30 years. It doesn't go away. You've been on every antibiotic known to mankind. You're becoming sensitive to many of them. And as I said to you, my thought process is that they're probably not treating the right thing. And at this point, every type of culture should be run before they touch you again, and not just arbitrarily writing a prescription, for that type of thing. It sounds perhaps like a yeast or mold or fungus infection, or that your bladder's not emptying completely, so it's becoming like a petri disk and reoccurrent infections. But the problem is that if it was bacteria, you should be able to get rid of it. The other thing that you're going to look at is dietary patterns that may cause it to reoccur. If you're getting sugars in your diet and dairy products, that's the right setting, by the way, to bring all of that about. So this Wednesday evening actually would be a great opportunity for you to have it looked at. We could give you a little bit more personal advice on it, one-on-one. But you need to ask your doctor. And, this is the thing that you'll walk away with on this Wednesday evening. You'll be able to ask your doctor intelligent questions about why and what other testing. And unfortunately, some of you will know more than they do after you walk away from this class. Let's go to the phones. Robert, how can we help you? Thank you for calling.
Hi, Dr. Roselle. Great talking to you. Listen, I have my vitamin D level is always a little low, but it's normal now. It's 30.4, and I was trying to get it up. I heard if it can go up to 100, and the higher the better. I'm taking 4,000 international units twice a day. I eat a lot of fiber in the morning. Someone told me that I'm losing it when I have bowel movements in the morning.
Well, first of all, let me touch on that real quickly, because I don't know your particular situation. So here's the parameter that I'm going to give you. If it's at 30 and you're taking 4,000 units, you're not absorbing a lot of it.
Yeah.
And so we have to find out why you're not absorbing it. Vitamin D should be taken on an empty stomach and by itself to start with. There are other things. Now, if you're my patient, there would be things I would tell you to take with it, and that would allow it to absorb more rapidly.
Well, first, do you have your gallbladder?
What's that?
Do you still have your gallbladder?
Oh, yeah, I'm fine. I have all my parts.
Okay, well, that's good. And I would check, first thing I would check, see if that gallbladder's working right.
Right.
It's putting out the bile salts to absorb the fat-soluble vitamins. That's probably the most common thing I see with people that just can't get their vitamin D levels raised up. You throw in some things in there to help thin that bile down and get it out more productively, you start absorbing those fat-soluble vitamins, and then you'll see that vitamin D level start to increase. But really, you want it up around 70, 80.
Yeah, you don't want to start jacking up the vitamin D just arbitrarily. Normally, when we do things, we'll hit it at a certain level every day for about 100 days, and then redo the laboratory test. But before that, we're also going to check other soft indicators of gallbladder function and absorption. And is the gut able to transport it in and so forth. All those things are critical. So it's not just take this, or we don't know enough about you to be able to tell you X, Y, and Z are appropriate. But
does it make sense that I'm eating a lot of fiber in the morning and
no, has nothing to do with it.
No.
Huh? Has nothing to do with it.
Oh, it has nothing to do with it. I see.
Has nothing to do with it.
I saw in the call notes that you also have Sjogren's.
I called in for an 86-year-old lady who's very spry, and she has Sjogren's, and you told me that you could cure it. Can I tell her something to motivate her to
say that we could cure? Whoa! Robert, listen. I didn't say anything about cure. So let's get that straight. Sjogren's is an autoimmune condition, and it's associated with high levels of certain types of antibodies, and you end up with a problem with adrenal function, and the body begins to break down. So there's no definitive test for Sjogren's patient. There are subtle tests. You're going to use a rheumatoid factor. You're going to do anti-nuclear antibodies. You're going to do SSAs and SSBs. These are things that will give you a suggestion based on other things. About 70% of patients that are called Sjogren's patients have a positive ANA. It's a good way to monitor that, and there are other inflammatory markers that you want to use as well that would give you some parameters. So when you have a positive ANA, the antibody test is suggestive of some sort of rheumatic disease. Rheumatoid arthritis, a lupus condition, Sjogren's, and something of that nature, but it's not specific. It has to fit a certain parameter. So diagnosing a Sjogren's patient often is difficult because there are other pieces that are overlapping, and so you have to make sure that that you're running the right test. So when you look at a Sjogren's and you're running, I mentioned SSAs and SSBs, they're consistent with other pieces of the puzzle. They're consistent with lupus patients because they suggest a tissue problem. So again, I want to go back to what I said. I didn't say that anything about cures, so be careful with throwing those things in there. What I'm saying to you is that a Sjogren's patient is an autoimmune condition that, if supported properly, many of these patients go into remission, and you see their markers and their laboratory levels begin to drop dramatically, and they get their life back.
You can manage it very, very effectively.
So those are the things that we need to do. You look at the nervous system in this type of patient. You make sure that the neurological pathways are balanced properly, that the body has every opportunity. You get rid of any kind of sensitivity, allergen. You get rid of heavy metals out of the body. And it seems to
anything that's an immune irritant.
It is.
You get rid of it.
Yes. So you look at it that way. So those are the parameters, Robert, and you have to make sure that we understand. It's like we treat a lot of MS patients, multiple sclerosis patients, but we don't cure them. But what we observe is that the body begins to go into significant states of remission, and many of them stay that way for a long period of time. So, we have to make sure that we're clear on that, okay?
Okay. Thank you very much, Doctor. I appreciate it.
You're more than welcome. Thank you for calling. Appreciate it. A lot of patients, and, I'm very, very careful not to say, that there's a cure in virtually anything, simply because of the fact that if the patient goes back into their lifestyle, the things that brought it about in the first place, their markers are going to come back.
Correct.
And, there are patients who have predispositions. We know in epigenetics that the body can begin to resolve and change and turn things around significantly. So, if a patient lives well, meaning they're balancing the structural, chemical, emotional platforms, the nervous system is working, the biochemistry is doing what it's supposed to, and their emotional state is solid, then the body has every opportunity to resolve issues, period. And that's what we see. You don't have to throw medication at it necessarily, and it's often appropriate to work hand in hand with a physician who's put them on these drugs.
Right.
And because when you start seeing changes, for example, had a patient that's been a patient of mine for many years and on huge amounts of statins. And his physician says, well, we want your cholesterol as low as possible. Well, no, not unless you want to kill the patient. You know, if you get it down to way too low, the person's not going to function, you know, in a normal level. But he's also diabetic. And I told the patient the reason you cannot control your diabetes and you're on this, you know, the short-term and long-term acting insulins is because they're giving you way too much statin. And I printed out all the information. I handed it to him. And after all these years, he had a conversation with his doctor, and they got the statin dropped, and he on his own decided to stop it. And what happened was his blood sugars became controllable.
Yeah.
And these are the things that we have to look at. You have to be careful of the overriding situations. And in dealing with laboratory testing, this Wednesday evening at the Roselle Center for Healing in Fairfax, we're going to be talking about what laboratory parameters are real, what are incomplete, what you should ask your doctor about. And we're going to give you that data. We're going to give you information. And sometimes...
And rechecked. That's the other piece.
That's right. And just looking at things doesn't work.
Right.
Well, let's watch it.
No.
What does the heck does watch it really mean?
If you're not going to do anything, if you're not going to take any kind of clinical action, don't bother running it. But if you're going to take clinical action, then you should see a change. That's why I like laboratory work. We want to see subjective changes with the patient. We want to see the patient say, hey, I feel better, I'm doing better, I've got more energy. But we also want to see those objective changes. And that's why the laboratory work's great, because you can look at those things and you can see them. My vitamin D has gone from 30 to 60. Great. Let's rerun it in another 2 months and make sure it's going up the rest of the way. They're good objective things you can look at.
You know, one of the things that used to drive me crazy when talking about vitamin D is that a physician will put a patient on 50,000 units of disulfiram, which is D2, which is the artificial form. And they give it to them once a week, and they'll give it to them for about 6 to 7 weeks, and they see the vitamin D level go up. Not necessarily up where it should be, but it goes up. It's all better now, so you can stop taking the vitamin D.
Yeah.
Not. You know, you never fix the problem that was causing the vitamin D not to absorb.
Right.
And when you realize that 80% of us or so in this area are vitamin D insufficient or deficient, that tells you that you got to do something else. And
you got to drink more milk.
And you got to drink more milk. Yeah, right. And you know, you talked a lot about the gallbladder function. We talked a little about liver function, and we talked about the intestinal tract. These are important criteria, but this Wednesday evening we're going to get into the nitty-gritty with this stuff, and we're really going to talk about what you really have to look for, what they really mean. You know, well, yeah, you're okay, you're low level, but you know, we don't have to worry about it as long as you stay within their parameters. We still feel like crap. You better do something about it.
Yeah, you better fix it. And then not just only the blood test, but we'll talk a little bit about salivary testing. I'll talk a little bit about stool testing. You know, there's a lot of stuff you can test, and it gives you great functional data. And we don't do those things enough. People need to, and if you don't know what different stuff is out there to look at to really solve your health problems, you know, you're never going to get them done. So that's part of it, is just educating the patient, letting them know, hey, these are the things that are available. These are the things you can check. You know, you mentioned earlier, I'm going back to our old thyroid problem. You know, T4, T3, total T4, T3 is the amount of that hormone that sits in waiting, if you will. Mm-hmm. It's like the swimming pool full of water. But the available for transport is the free T4 and free T3, but you have to have the one other piece, and that's the uptake. Right.
And whether it's male hormone, the androgens, or female hormone and androgens, you have to know what's getting in. And that test is saliva.
Right.
That's what's really getting into tissue. How many of your doctors do that? And I know this Wednesday evening you'll talk about that in depth.
Yeah, absolutely. There's pros and cons to all those tests. But, you know, the big thing we're going to talk about with a lot of those tests, too, is what does it really tell you? What does it really mean? And that's the thing that is missed more than anything else, is what does this lab test really tell you? What does it really mean? And that's skewed so much of the time.
How about the patient that comes in, you know, with their laboratory tests, or they have laboratory tests and that they ran in their doctor on lipids, their cholesterols, their LDLs, HDLs, triglycerides, and then they have the ratio, right?
Yeah.
And then the doctor says, we're going to put you on this. They drop it down, and they still drop dead from a heart attack.
Yeah.
Because they didn't ask the right laboratory question, right?
Right.
There are many other markers.
There's lots of other markers. That's we compartmentally, we're taking a fraction of what really needs to be run to really come up with a good diagnosis. It's all based around, you know, pharmaceutical need and dosage.
This Wednesday evening, Dr. Leonard Poe, my guest in studio, your host this Wednesday evening at the Roselle Center for Healing. Dr. Poe is the clinical director of Core Concepts Chiropractic by Roselle in Ashburn, actually Broadlands. This is going to be a really excellent night. You're going to get an understanding that you wouldn't have had before. All you got to do is call us at 703-698-7117 and register. Better yet, if you're on your computer or your iPhones, go to rosellecare.com. That's ROSELLECARE.com. rosellecare.com, and scroll about halfway down. You're going to see the class. Hit the button. It says register here. And by the way, these classes are our gift to you. They're our gift to you. They're free. And we want to make sure that you take advantage of them because we want to educate you. Let's go to the phones. Betsy, how can I help you?
Yes, sir, Dr. Roselle. I was wondering if you could tell me if you would think I should go to see a chiropractor or a specialist doctor first. My shoulders, I can hear it in my mind. Sometimes it'll sound like ice breaking up. They hurt all the time pretty much. When I lie on my back, they hurt really bad. When I put them over my head, behind me, in front of me, they hurt. I do clean houses from a living, and I know I've abused them a lot with repetition, but I just don't know where to go at, who to see.
Okay, so Betsy, you always go minimally invasive first. So see a chiropractor. Okay. And the chiropractor, if they're good and will help you, get a referral. But see a chiropractor first, because so many shoulder and hip and knee problems that are a result of muscles not working the way they're supposed to, and that comes from the spinal system, the neck. So if the neck is irritated, those shoulders are going to scream, and particularly the kind of work that you've done over a period of time. So do that. Send us a note. Be more than happy to see if we can find somebody in Williamsport for you. Off the top of my head, I don't know someone, but we're happy to look through and see if there's anybody out there that you can touch bases with. Give us a call. We're coming up to that part of the program where we have to take our last break, and then we'll be right back, and we're going to kind of tell you what we're going to be doing this Wednesday evening. I think you're going to find it fascinating. Don't go away. We'll be right back.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. You've been listening to Dr. Tom Roselle live, as you do every Sunday at high noon on the Eastern Seaboard. Those of you who are throughout the different parts of the country that listen to us, we thank you very much. Do the math. You know where you're at. And somehow, as we've said many times, many of you are listening through different armed forces channels. I don't know how you get that done, but thank you. And we try to get back to you with the information that you're requesting from us. We appreciate your service, and we couldn't do it without you. My guest in studio, Dr. Leonard Poe, will be your host, your presenter this Wednesday evening at the Roselle Center for Healing in Fairfax. He's going to be talking about laboratory diagnoses, and more importantly, what things are being missed. Dr. Poe is the director of Core Concepts Chiropractic by Roselle in the Broadlands, and he knows his stuff. I mean, this is an opportunity really to get the nitty-gritty and to find out, my doctor says I'm not feeling well, but or you're not feeling well, and your doctor says there's nothing wrong with your laboratory work. Well, it's maybe because they're not ordering the right stuff. And as Dr. Poe said earlier, if you order something, you need to be able to do something with it or don't order it. Dr. Poe, talk a little bit about what's going to happen this Wednesday evening.
Right. So I'm going to break it up in a couple different things, but, we're going to talk about, like you said, the stuff that you should be getting. What's the basic stuff that you really should be getting? And, which is way more than the stuff you're getting now probably. But what are those basic things you should be getting? The difference between those crappy statistical numbers you see on that lab work and what are really functional numbers where your value should fall. And then what are some other, out of the box different kinds of testing that you can look at that gives you an idea of, maybe you're not dying, but why you feel as bad as you feel all the time. But be my guest. Come out and, let's talk about it, go over it. I'm going to stay. We'll answer lots of questions, and hopefully you walk away with a better understanding of what to ask for and some ammunition on how to ask for it and why to ask for it.
And then also, what do you do with the test once you have the information?
Yeah, when should it be checked again?
Is medication the only way to treat something like this?
Yeah.
If you're in pain, if you have, and they put you on opioids, or you're in pain and they're telling you to take any kind of the NSAIDs, what other things do they need to measure? Does your doctor understand that there are other depletions that are occurring? There are other things that can take place.
Are these tests for measuring symptomatology, or are these tests for measuring calls?
And the cause is the piece that you want to know.
And that's if you want to fix, yeah.
Again, it always makes me very curious. I have other terms I can use for that. It makes me curious why I'll look at a test, and we've had the same courses in laboratory diagnostics. And I'll come up with X, Y, and Z, and I send the patient out, and we get further testing and evaluation. It comes back positive. And so many physicians, and not because these guys are bad guys, it's a process of understanding systems.
Right.
And you have to really understand the system to be able to put your finger on the cause of the problem and then be able to do something about it, and not just do an insurance checklist or a drug company checklist.
Right.
You know, we said many times the cholesterol, total cholesterol, and LDLs and HDLs and triglycerides, that's what the insurance companies came up with. And the parameters of dropping them down so low is what when I was in school, just a real quick marker, right? Back in the day when the dinosaurs ruled the earth. Quit laughing, Dr. Poe. So, total cholesterol normal was 235.
Yeah. It's changed dramatically over the years.
And now it's under 200.
Well, it's all statistically driven, because who gets their markers checked all the time? People who are on statins. So it's brought that, because you have to understand that lab range is all based on statistics of what we see as the median and the standard deviation when people go in and get it tested. So it brought it down over the years. So now it's, under 100. It's ridiculous. There's no scientific basis behind that number at all.
No, none whatsoever. And unfortunately, you become the laboratory rat. So
Right.
this Wednesday evening, bring your laboratory values, and let's talk about them a little bit. And we can give you some direction, but more importantly, we'll give you the right questions to ask your doctor. And as always, we'll work cooperatively with whoever has your primary interest at heart. We're coming up to the end of the program. Unfortunately, we'll be back same place.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.